Hello, my name's Jake Andrews from the University of Nottingham and I'm working on the RADAR CNS project. RADAR CNS stands for Remote Assessment of Disease and Relapse Central Nervous System, and we're exploring the use of remote measurement technology in the care of people with epilepsy, MS and depression. Today I'm presenting the poster Implementing Remote Measurement Technology in Clinical Pathways for Depression, Epilepsy and MS, results from a large-scale survey of clinicians. So to provide some background, remote measurement technology consists of sensors and software in wearable and mobile devices, which can be used to record data on biological indicators and self-report data. And these kinds of data can be used to gain insight into physical and psychological health, for example, how active someone is being or what their mood is like. However, little guidance is available for their use in healthcare settings, and not much is known about how or whether data from these devices are currently being used in such healthcare settings. So the RADAR CNS project seeks to explore the potential of RMT in epilepsy, depression and multiple sclerosis in particular. In the present study, our primary objective was to understand if RMT is currently used in clinical practice, and secondarily, we sought to understand where healthcare professionals believe there to be potential for the use of RMT. So we conducted an online survey of clinicians working in the care of people with these three conditions, and we recruited with assistance from the Clinical Research Network, as well as via social media and through contacts of the research team. In total, there were 1,009 responses to the survey, and after data cleaning we retained 1,006 for analysis. So the main findings of our survey show that of 1,006 survey respondents, 56% currently use apps in their clinical practice, and 78% report that their patients use apps or wearables for health-related purposes. Now of these, 62% indicate that patients' RMT data sometimes or definitely impact their work. Lastly, 86% agree or strongly agree that technology is a good tool for helping patients to manage their own condition. Now there may be some positive bias here because our survey may have attracted people who have a more positive view on the use of technology in healthcare. However, these figures provide an indication that patients are using RMT and that the data from these types of devices and apps is being considered by their clinicians. This slide shows one of the figures from our poster, which summarises some of the condition-specific findings from the survey. Respondents were asked whether each of the following data sets would be useful to monitor over a period of time, and bars represent percentages of yes respondents minus percentage of no respondents. So bars above the x-axis indicate data sets that were more positively endorsed in each condition, while bars below the x-axis show those that were more negatively endorsed. And this allows us to compare perceived usefulness between conditions for different datasets, and the graph shows that body movements and sleep quality were both strongly positively endorsed across all three conditions, while GPS data, smartphone usage and voice quality were seen as more useful in certain conditions and less useful in others. So I'd invite you to pause the video to explore the graph further. So these data show us that RMT is currently being used by clinicians and their patients, and where it is used by patients, most respondents indicate that data from their apps and wearables have some impact on their work. And also clinicians see promise in the use of RMT to help patients self-manage their conditions. So we think it would therefore be timely for guidance to be produced on the use of RMT data both for clinical practice and for patients who self-manage their conditions using such technology. And our results also indicate potential for RMT in all three of the conditions of interest, with variation in particular data streams considered to be of most use in each. And thus patients and clinicians will benefit from condition-specific guidance on the use of RMT, as well as general guidance on principles of good practice for using digital data in healthcare. Thank you for watching this brief presentation. If you have any comments or questions, we'd invite you to post these below, and more information about the RADAR CNS project is available at our website. Thank you.